What is the impact of environmental change on pollen-related allergic diseases? For the first time in Europe, a European Union-funded consortium is tackling this question using a highly interdisciplinary strategy. This is the Atopica project.
Atopica aims to study the key factors influencing the risk of developing allergic disease to ambrosia. We chose to focus on ambrosia pollen due to its negative impact on the European economy. In fact, it increases healthcare costs, affects agriculture, reducing yields for commercial purposes, and endangers biodiversity and tourism. Atopica takes an innovative and multidisciplinary approach to explore the pan-European impact of changes in climate, land use, and air pollution on ambrosia-induced diseases.
Our role in the project is trying to understand who gets allergic diseases, why they get them currently, and then to start to think into the future. So under climate change in 50, 60 years' time, how might the incidence of allergic diseases change?
Climate change foreseen for the next several decades of the 21st century over the European region is expected to increase the occurrence of extreme events. Heat waves, worsening air pollution from higher temperatures, and stagnant conditions will potentially increase the spread of invasive plants like ambrosia.
We will try to take the latest generation of climate models and make our own generation of climate change simulations to have some general picture of how climate will change over Europe.
The concentration of airborne particle pollutants is being studied.
One of the threads that we want to focus in this project in Atopica is the combination of the pollen and the air quality. Because an airborne pollen can become more allergenic if it's exposed to air pollution, but also people who are exposed to air pollution may become more sensitive to the allergenic properties of the pollens.
Ambrosia, known as common ragweed, is an annual ambrosia herbaceous plant that originates in North America and began to spread in Europe after 1940. Currently, the rates at which ambrosia is spreading and at which individuals are becoming allergic to its pollen are on the rise. It is a highly invasive plant with allergenic pollen that causes hay fever, asthma, and atopic dermatitis.
Together with climate, human activities and policies cause changes in land use. Land use is another factor influencing ambrosia spread in Europe.
Ragweed is a very invasive weed. It produces lots of seed and it tends to grow on very disturbed areas, so roadsides and next to railways, and particularly in farmers' fields. And understanding where the weed will grow in the future will be a combination of knowing what kind of crops farmers are going to grow in the future under climate change and the interaction with the weather. And that information will then feed into models of pollen distribution and disease incidence across the continent.
One of the key issues is to calculate the fate of the pollen grains, how they are released from the flowers, how they are transported into the atmosphere, deposited, and then finally how they create the concentration fields.
The next step is to investigate the impact of allergenic pollens on health by studying patients and physiology in experimental animal models.
Atopica clinicians are studying how climate, air pollution, and land use will influence the development of allergic disease in vulnerable populations, like children and the elderly.
We know that in areas where we have the high pollen levels, 1/3 of children are allergic already. In the areas like Mediterranean part of Croatia, there is almost non-existing, because also there is almost non-existing exposure to the ambrosia pollen.
The elderly are vulnerable to allergic diseases, including eczema, hay fever, and asthma.
Asthma has a far higher mortality and morbidity in aged people. Even adult people who never suffered from allergy to ambrosia before can be affected.
There is an urgent need to understand how global and regional climate, land use, and air quality changes will impact human health.
We have been working separately, climatologists on one side, air quality on the other side, and we need now to gather and to assemble all our models. So this is a big challenge for the Atopica project.
So far you've heard people talking about how climate change might affect weather, how it might affect pollen, and also work on how that might affect sort of ragweed distributions, and also clinical information on people who develop allergic diseases.
The Atopica Consortium is a truly multidisciplinary research team composed of top scientists coming from very different fields.
We have to work with lots of people from different disciplines and ultimately come up with outputs that are relevant to stakeholders and policymakers.
They will provide really useful information to policymakers both at national and European levels. The Atopica Consortium will really improve the understanding of how environmental changes will impact on allergic diseases.
Keep in contact on www.atopica.eu.